Urologists take care of really complicated problems. They do a wide range of surgery. They really focus on the patient and the patient's quality of life. And I think urologists just tend to be pretty funny people. It's hard to be a urologist without having a good sense of humor. So I do a lot of surgery for people who have what's called a neurogenic bladder. That means their bladder doesn't work because of a neurologic disorder. It's something like a spinal cord injury, multiple sclerosis, spina bifida. I also do a lot of surgery for people who have radiation damage to the urinary tract and then damage from other kinds of trauma. So people with fistulas, with urethral strictures, with ureteral strictures. We use bowel to reconstruct the urinary tract. We put muscle in between the bladder and the bowel to fix fistulas. I take tissue from the inside of the cheek to reconstruct urethras. We do wild and crazy surgery, open and robotic and everything in between. It's finding creative solutions to really challenging problems. It's very exciting. Part of my job is to do diagnosis. I often do a lot of x-rays and scopes, sometimes in the office, sometimes with patients asleep. I do see a lot of patients who've come very far away, who've seen other doctors who've done some of the diagnostics for me. I always tell my patients it's impossible to embarrass a urologist. You have to try really, really, really hard. All I talk about all day is trouble peeing, trouble pooping, erections. We talk about infertility, we talk about cancer. We really only talk about things that are difficult to talk about. So for me, that's my entire job. And I love trying to help make a patient feel comfortable and make them feel like they've come to the right place and I'm going to be the one to help fix them. All of the care that I provide has to be really individualized because people come in with really specific problems and often problems that are pretty rare. And that's going to depend on, one, keeping their kidneys safe, keeping them out of the hospital, but a close second, what their goals are and making sure their quality of life is as good as possible. So I spend a lot of time with the patient talking about what our options are, what my first plan of attack is going to be, what my plan B, C, D, E, F are going to be, because I often need a lot of backup plans. I have wonderful long-term relationships with my patients. I tell the residents I'm a real glutton for gratitude, so I tend to take care of patients that maybe other doctors have said no to, and I end up getting a lot of gratitude from them, and that is why I keep doing my job. When I'm not at work, I'm usually hanging out with my children and hopefully outside. I love to run and bike.